So when cognitive problems occur in a patient with Parkinson's disease, it doesn't just affect the patient, it affects the spouse, the whole family. And it's important to recognize the effect that these problems can have on people who are close to a patient with Parkinson's disease. I think that patients are expecting to slow down, they're expecting to have tremor, and the family is expecting these things also. I think when the cognitive problems occur in Parkinson's disease, it can be an unexpected blow both to the patient and to the family, the spouse, and the other family caregivers, and can create a great deal of strain on these people. So it's important, I think, for the caregivers to get some understanding about how Parkinson's disease can affect cognition. There are resources available to help teach caregivers about what to expect from cognitive problems in Parkinson's disease. These are available on the NPF website. They're also available by talking to your local healthcare provider. In addition, it's important to recognize the strain that can be caused on a relationship by cognitive problems. I think that it's very important for a caregiver to not become overly frustrated with the patient because of cognitive lapses and to blame the patient for these things. It's very easy to do. If you find yourself slipping into this kind of thing, it's important to tell your doctor and probably also to talk to a psychologist to learn some strategies for managing these negative emotions that come with the cognitive lapses that can occur and the friction that can be caused socially by them. In addition, it's really important for caregivers when they find themselves caring for a patient with Parkinson's disease and cognitive problem to make some time for themselves. I think a lot of times caregivers that I know feel like it's their job that when they got married, for example, they signed on to, for better or worse, and to be a full-time 24-hour caregiver for a Parkinson's patient. And this is terrific, and it's laudable that most spouses I find are really dedicated. On the other hand, burnout from taking care of a patient with Parkinson's disease is really common, and I strongly encourage caregivers of my patients to make some time for themselves, at least a couple times a week, to get out and do some things that are just for themselves so that they can recharge their batteries, maintain some connection to their normal daily lives. And this is crucial for their own mental health, and also it makes them better caregivers because I think that some of the anger and resentment that can build up from being a full-time caregiver to a patient with Parkinson's disease who also has some cognitive limitations can ultimately lead to them being less effective and compassionate when it comes to dealing with their family member.